Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel. Once again, reminding you that if medication fixes your problem, that makes it a medical problem in your body, not a mental problem somewhere in your psyche. Hope that's encouraging to any of you who are taking or are considering taking brain chemistry medicines in order to feel, think, or behave in a better fashion. So I saw a guy yesterday who is doing so well on a starting dose of 10 milligrams Ritalin twice a day that I realized when I was talking to him about the channel, I have not done a product-specific video on Ritalin. I get talking about other stuff and thinking about other stuff. But Ritalin is a medicine that's been around for decades. It is a really good tool. And I just wanted to create a video for you today to talk about Ritalin. The generic name for that is methylphenidate. And the old brand name is called Ritalin. And that trademark is long expired. This medicine has been generic for a very long time. But it is an important medicine to know about because any time that you need to consider boosting norepinephrine, if norepinephrine is here and you want to boost it to here, then Ritalin is one of the options, in my opinion. That's a really good tool to use. Now, boosting norepinephrine, let's start out to talk about what that really is about. Low norepinephrine can cause lots of things. It can manifest itself as depression. It can manifest itself as anxiety. But very commonly, if you don't have mood symptoms and you don't have anxiety symptoms, but you have symptoms of attention deficit, so can't focus, can't concentrate, can't pay attention, starts and stops, easily distracted, basically underperforming, losing things, underperforming relative to your IQ, that's where the diagnosis of attention deficit disorder needs to be entertained, and not just simply not concentrating, because not concentrating can be caused by lots of problems, but when the whole picture's there, and then when the consideration really is, hey, is this ADD/ADHD, which truthfully, I don't make a huge distinction between those two, because in my mind, both of them are caused by this. That's low norepinephrine. So when you're attacking low norepinephrine, there is a couple of ways to think about it. Number one, I've done videos on Wellbutrin before. Norepinephrine is a medicine, is a chemical that is made by your brain naturally by a gland called the locus coeruleus. It's a little almond-sized thing in the base of your brain. You don't have to remember that name, but it's really important to understand that norepinephrine is a naturally produced chemical. And if by virtue of your genetics you simply don't make enough, low norepinephrine can be a big problem. And in the context of attention deficit disorder, Wellbutrin is a medicine that we use a lot, and you've seen the video maybe on that. If you haven't, you can watch it, about how Wellbutrin, if I hold my arm like this and talk about this as the sort of like the neuron that makes the norepinephrine, if those neurons that make norepinephrine are encouraged by Wellbutrin to be healthier, be more active, make more norepinephrine, then that's how we believe that Wellbutrin works. Now, the truth is we don't really understand exactly how these medicines work, but in theory at least, the idea is that the norepinephrine system is made more robust with Wellbutrin. Now, the opposite, or the alternative, not opposite, but the alternative to that is if you can take that norepinephrine neuron and make it more vigorous. That is to say, if you can make it spit out more norepinephrine from the ends of it where it makes, instead of making it here and producing it and get out there and that being more vigorous, I call these medicines the release agents. So the other one is Adderall, the dextroamphetamine group, but the methylphenidate group has arguably been around longer and is probably as well known as the Adderall. Adderall has gotten known, I think, just through modern culture. But Ritalin is a marvelously effective booster of norepinephrine by causing release of norepinephrine. So, bottom line, Ritalin is a norepinephrine booster. If the target is here, that you're low and you need to be here, well, it is a tool that you can use. Now, let's talk about the dosage of Ritalin. The guy yesterday was a really good example of you never really know. The fella I'm thinking about probably is at least my height and probably taller than me and maybe about my weight. And 10 milligrams twice a day was enough to make him feel significantly better. In children, a lot of times we can use smaller doses like 5 milligrams twice a day or 3 times a day, and you can work your way up. to the 5 milligram tablet size, the 10 milligram tablet size, all the way up to the 20 milligram tablet size, in my opinion. And I typically stop if I've got a patient that is doing not so good on 10 milligrams 3 times a day. And 3 times a day is, you got to be careful. If you, that last daily dosage of Ritalin, methylphenidate, can keep you awake. So most people that take 3 times a day Ritalin, it's 1 in the morning, 1 early afternoon, and 1 not too late afternoon, maybe 4 or 5 in the afternoon is the latest for a normal work day. And patients have to gauge that for themselves. Is that a problem with stopping their ability to fall asleep? And sometimes they have to shift the schedule forward. But 5 3 times a day is not uncommon. 10 3 times a day is not uncommon. And if that's not working, I will go personally in my practice as high as 23 times a day. On rare occasions, I'll go higher than that. But that's a really good sort of fence to try to maintain that. Beyond 20 milligrams 3 times a day, you got to really think, what am I doing here? Some extraordinary patients I've had received other patients on higher doses, and I've given them higher doses because they've done well at that. But in general, 20 milligrams 3 times a day is pretty much the guardrail. Now, 3 times a day medicine is hard to take, and so obviously the people that make medicines, they figured that out early on. And so long ago, there was a product that was very good called Ritalin LA. And 20 milligrams of Ritalin LA, or 10 or 20 or 30 of LA, or sometimes 2 of the 20s. They might even have made a 40 at one time. But the long-acting form of Ritalin has been available for a long time. Now, these are all generics, of course, now. So there are various forms of methylphenidate. The other one that was brand name called Concerta. Concerta is another form of methylphenidate. It's another once a day. The dosing of it is different because of the release method that they use. And so that dosage is either 18, 36, 54, and we will go as high as 72 for some patients, depending on their height and their weight and their overall clinical picture. But the long-acting forms are available for people who want to take medicine just once a day in the morning. And that's if you do shift work, or it's hard for you to take medicine during the day at work, then a lot of times a once a day is a better tool. So those are the basics. What about side effects and Ritalin? What do we look for? Well, early on, Ritalin got a really, really bad reputation because, and if you're my age, you remember this. People that are probably under the age of 40 have never heard this before. But we used to hear the complaint that Ritalin stunts your growth. That was a big thing with kids, that Ritalin stunts your growth, and so you need to be very cautious about giving Ritalin. Well, the truth is, what was happening is those young kids who were, sometimes 7, 8, 9, 10 years old, when they're still growing, they were getting really high doses of Ritalin. And those really high doses of Ritalin, 20, 40, 60, 80 milligrams a day, they didn't know it at the time, but those high doses they believe caused the growth plates in kids' long bones to stop growing properly and somewhat to fuse, is the term, and to stop performing normally in terms of growth. So there was kids who actually suffered the effects of too much Ritalin early on. Now we learned that was really because of excessively high dosing in kids. So after that sort of shock to the whole system of can you use Ritalin, yes or no, really we've learned that in low doses and appropriate doses, even in kids, as long as you don't give high doses, that Ritalin is a good tool. Now, another thing that I talk about with Ritalin and norepinephrine boosting in general is that a lot of people have this idea that you should only take the Ritalin when you need it. And so a lot of people will say, well, Ritalin, do I have to take it, every weekend, or do I have to take it when I'm not working? So there was an old idea of taking what was called a drug holiday. And the idea was that, if you stay away from the medicine, then it's more effective on Monday when you pick it back up. So people would not take their medicine on Saturday and Sunday. They wouldn't take it when they're on vacation. They wouldn't take it on their days off, things of that nature. Well, what we learned is that your norepinephrine doesn't just sort of like fine on the weekends and down here on weekdays. It lives down here. So whether or not you're in school or you're working or you're just trying to do your activities of daily living, like balancing your checkbook or paying your bills, norepinephrine being normal matters. And if it's low, that's a problem, and you want it to be normal. So decades ago, we stopped saying, hey, take the weekends off with your medicine. Decades ago, we started treating norepinephrine shortage as a 24/7, 365 condition. And so in the same way that if you need contacts, you don't just put them in contacts when you're going to read the fine print. You wear your contacts all the time, which I do. Or you wear your glasses all the time, which I do. And so that's the encouragement we give to people when your norepinephrine is low. If you've got that condition, if you're taking Ritalin or anything else that boosts it, we encourage you to take it for consistently to get the 24/7, 365 improvement with your norepinephrine. Now, the medicine does run out. It does only work if you're taking the regular immediate release form. It wears off in 4 or 5 hours, and that's why you have to take it multiple times per day, unless you're going to decide to take the once daily dosing. And honestly, in my practice, there's some people that just really like to have the 3 times a day. It's sort of a routine they do, and other patients like to have either the Ritalin LA once a day or the Concerta form once a day. So Ritalin is a medicine that I use. I'm surprised I haven't made a video before, because I probably write 2 or 3 prescriptions per day in patients that I'm taking care of. And when I'm seeing a patient for the first time, like I did this gentleman that I saw yesterday, because honestly, the availability of Adderall has been really hard through the early 2020s years. So this is 2026. Starting in 2020, 2021, Adderall and the production of Adderall there's been disruptions in the pipeline. People have had difficulty getting it. And oftentimes Ritalin is actually easier now to get than Adderall. So a lot of times I will preferentially offer Ritalin as opposed to Adderall, just simply because it's easier to get and the pharmacies aren't going to have as much difficulty serving the patients. So that's the quick video that I have about Ritalin methylphenidate. I hope it's helpful to you if you're taking it and you didn't know that it was a norepinephrine booster. Well, now you know. If you're considering taking it and you believe that you have the symptoms of norepinephrine shortage, if you think you're here and you need to be here, then I encourage you to talk with your provider about the possibility of taking Ritalin. Obviously, you have to talk about the side effects. I should mention that the side effects of Ritalin, most often when people don't do well with Ritalin, it's jittery, jumpy, nervous, sweaty, like they've had too much coffee. Sometimes feel like they're jumping out of their skin. It's pretty rare if you start at low doses with Ritalin that people just feel that they're completely wired. But if they don't like it, if they feel jittery, jumpy, nervous, sweaty, or have other, heart racing or something like that, obviously they have to stop it, and they will stop it. We tell them in advance if that happens, stop it. And it might be that 2 things. It could be that their body might just not relate well to the Ritalin, to the methylphenidate. The other possibility is they actually don't have a norepinephrine shortage, that they are here with their norepinephrine, and if you gave them a norepinephrine booster, well, they're here. And if they are supranormal, above normal with the norepinephrine, that can cause you jittery, jumpy, nervous, sweaty, jumping out of your skin, and feel like your heart is racing, that cluster of symptoms. So obviously, as with every medicine, when we're doing troubleshooting brain chemistry, first empirical trial is try this. If you have acceptable side effects, give it a shot and see what happens and continue it. But if it makes you feel terrible, the first 2 or 3 doses, you have no choice but just to simply stop it. Call the office, report that you stopped it, and we'd have to do the next thing, make the assessment. Was it the wrong medicine, or are you really not here? Are you really here and you need something in a different system? That's a troubleshooting method. Okay, now I'm signing off this video on Ritalin. I'm happy that I shared that with you. I hope it's helpful to you. I hope it encourages you if you're taking it or thinking about taking it. I'm Dr. Dave, Psychiatry. Thanks for coming to see me today.